I'm a surgeon. I've got some time between cases, so I'm going to teach you how to suture like a surgeon. I'll start off with the basics, but I've also got some advanced tricks that even the chief residents can learn, so stick around for the whole video. Palm your needle driver. You should never put your fingers in the holes here, so you're just gonna rotate that in the palm of your hand and you can manipulate everything about the needle driver just like that. So grab an old needle driver from like an ER suture kit or something once it's done and just do this in your hand between consults or at home when you're watching TV. You'll get very, very used to not putting your fingers in here. And in fact, for teaching purposes and demonstration, I've actually taped over these holes to show you that you don't need them. You wanna give yourself about a 30-degree bevel. That's gonna give you the most degrees of freedom to manipulate this through tissue, and you want to grab it back pretty far. You want to give yourself plenty of needle to go through the tissue. You don't want to grab the very end because that's a brittle part of the needle. When you're using the needle driver, you're going to position the handles in the palm of your hand. That's where it's going to rest, and that's how you're going to manipulate it. Put an index finger closer to the needle. That allows you to have much more control over the tip of the needle driver. This next step is a little more advanced, but it's worth the work, and you're gonna look so slick in the operating room, and you're gonna save a lot of time when you do it. Keep your suture scissors on your ring finger. So when you're done sewing, what you do is just flip out your suture scissors just like that, and you're ready to cut. You go back and you're ready to go. So you don't have to wait for somebody else to cut your own stitch. I like cutting my own stitches. I think I get a much better feel when I'm cutting the stitch myself. So again, you're gonna sew, flip this out, snip, and you're ready to go on your ring finger. Never grab the tip of your needle. The tip of your needle gets dull almost instantly from the first time you grab it. So you're never gonna pull through from the tip, and make sure you hand it back protected. You don't wanna grab the tip of the needle unless you're done with it. So what you do is you grab right about here, again about 80% of the way back, and you just bend the needle back. And that gives your scrub tech a safe needle when you pass it back to the table.